I teach my students, I'm thinking about two things in parallel. I'm teaching about skill building for them because they need to build the right legal skills to be able to be good advocates, to be able to shape the law, to be able to create the kinds of effects that they want to, no matter what tools they're using. And at the same time, what I want them to see is every time the court touches something, every time Congress touches something, every time an administrator makes an interpretation, the things that they do affect people's lives in dramatic ways. What I would love to see over the coming years, over the next decade, is the ground evened a little bit so that we can reduce some of the disparities in health in this country. And what it will take to do that is coming from multiple angles. We'll need to see the gap closed on the number of people who go uninsured and uninsured. And then we'll need to see dramatic efforts by the law to make sure that people get access to the kinds of things that we know makes them healthy, which is much more complicated than just medical care. It includes better job access and income equity and clean water and high quality food and stable housing. So it's a lot to think about at once, but I think we could chip away some of those pieces to try to address some of the worst disparities that we're really seeing play out in a dramatic way during the pandemic. I'm working on two pieces in particular. One is a white paper with colleagues Howell Jackson at Harvard and Amy Monahan in Minnesota. And what we're thinking about is, are there places where Medicare should be offered to employers, where if employers chose it for all of their employees, it would be better for the employers and better for the employees? And then the second piece I'm doing is a really fun project where I'm joining my mentor, Ted Marmor, on his book, The Politics of Medicare, and we're creating a third edition together. So it allows me to revisit some of the history of Medicare and how it passed and how it's changed over time with him, and kind of how that history tracks forward to now, and where there have been discontinuities and where it's likely to go.